All right, Carissa, give me an update. This is visit number 3. We've had some good results so far. Just a quick background. You started off with having low back pain for 4 or 5 years. And were you having that pain for 4 or 5 years? Was that like an everyday constant thing? Was it a couple times weekly or a couple times monthly?
It was most days of the week, but not every single day.
Okay. And did it come more with activity or with rest?
More with activity.
Okay, very good. And so we've done 2 adjustments already. How does it feel now?
The bottom of my back feels good. My neck feels good, but the top of my back today is like, it just feels like sore. It's not like, I don't know, it's different than like the normal lower back pain. It's like soreness.
Okay. All right, so we'll get to the upper back in a second. Let's go back to the lower back. So after I adjusted you the first time, have you had pain since then in your low back?
Very little. Not
Very
much.
little. Okay. Now you're having some upper back pain. How long has that been there?
Just since like yesterday.
Okay. Did you do anything to it? Did you have any accidents, injuries?
I had softball yesterday, but I didn't like hurt it at all.
Okay. Did you have an intense practice? Did you do something new?
Not really.
Nothing
No.
special?
Mm-mm.
Okay. And so you had a little bit of a migraine situation after our first visit. Any migraines after the second visit?
Mm-hmm.
Okay. And you had a previous history of migraines, but you hadn't had one in a while, correct?
Yeah.
Okay. Very good. So we're headed in the right direction. I think that after today's adjustment, you should be more than 75% of the way there. Let's check out what's going on in the upper back and see if the low back needs adjusted again, and then we'll go from there.
Okay.
All right. Let's see what your spine says. All right, Carissa, first thing you're going to feel is my hands on your feet. Good. We got a left short. Let your feet relax. Good. Switches over. Lift your left hip up just a little bit. Good, down. Right hip up just a little bit. Good, down. One more time, lift up. Good, down. Good. Okay, we're going to start off with the instrument here, nice and gentle. Remember how we talked about that right side of your back was up higher?
Mm-hmm.
It is much better today. They're almost even. Okay, I'm going to push into your spine. Nice and gentle. We're just going to kind of move up this way. Did you crack anything on your own spine today?
Not on purpose, no.
Okay. Do you have softball tonight?
No.
All right, let's check those trigger points here that you had in your glute muscles. Tender?
Yeah. On the right.
More on the right than the left?
Yes.
Here?
Yeah.
Same?
Yeah.
Here.
Not really.
Good. Here?
No.
All right. Tender.
Yeah.
Tender.
Very little.
Tender.
No.
Tender.
Yeah.
I found a couple things to adjust today. We're going to adjust the thoracic spine first, okay?
Mm-hmm.
Then we'll come down, we'll do your hips, we'll get this right SI joint adjusted. And then we'll do your neck. 1, 2, 3, 4, 5. We're going to start with T4, 5 here on the right. So, just like before, take a nice soft breath in through your nose and out through your mouth. And I'm going to very gently just come down with your breath here and give this a little push. It's already starting to move. I'm just going to do that breath again. And out. Good. Nice and gentle. Still tender?
Yeah, a little.
Just a little, okay. Another deep breath in through your nose, far in as you can go. Good, and out. Okay, I'm gonna take the blocks out. Just relax for a second. Okay, let's go like this. Keeping your knees straight. Lift this leg in the air. Good, down. Right leg. Down. Okay. Okay, let's do this. Lay on your side. This side up, facing over here. The top leg. Good. That's good. I'm going to scoot you forward just a little bit like this. And a little bit right there. That's perfect. Okay, nice and loosey-goose, just like that. Let your shoulders relax. Nice breath in through your nose. And out. Good. Let this go. Loosey-goose. Good. Lay on your back. I like that ring you have.
Yeah.
Is it a wave?
Yes.
My girlfriend sent me a picture this morning. It was her on the beach. She was like finding shells. She's in Florida right now. And like there's the ocean in the background. And I was like, the ocean's waving at me. That was funny. All right, here's one of your primary findings on the right SI joint. We're gonna scoot you forward just a little bit there and a little bit here forward too. That's good. Okay, now let your shoulders relax nice and loose. We're gonna come down at the bottom of the sacrum and we're gonna go upwards. Nice and gentle here. Good. We're gonna do one more. Good. Lay on your back. All right, I'm gonna do a leg check for your neck. So what I need you to do, Carissa, hold on, let me just get a length here. We've got a right short. Go ahead and turn your head to the right. Back to center. Now to the left. Back to center. Now bring your right ear to your right shoulder. Back to center. Left ear to left shoulder. Back to center. Good. And bring your chin to your chest. Back to center. Push your head back into the table. And relax. Good. Tender?
Yeah.
Okay, so this is 2, 3, 4, 5. 4, 5 on the left. Tender right there.
Just a little.
All right, let's check your occiput here. Let your head relax. There you go. The occiput is clear. On the right, C1, C2. All right, we'll do the left side first, okay?
Mm-hmm.
Okay, nice and gentle. We're gonna bring your head over to the side like this and just let it go loosey-goosey. Let's go, 4, 5. And right from here, we'll give it a little push like that. Close your eyes and just take a nice soft breath in through your nose and out through your mouth. Okay, that was perfect. And now one on the right. Now let your head drop in, let your shoulders drop in. Good. Let this go. Close your eyes, soft breath in through your nose and out. Good. Let your head drop. Good. Let your shoulders drop, let your everything. And we'll do one more on the one more in the middle. We're gonna lift your head up and kind of pull it this way. Do you remember this one?
Mm-hmm.
And it kind of just popped already. So just let your shoulders relax here, and just sink in. Very gentle. We're gonna do this here. Let this go. Let's test out your ankles here. We're gonna test the talus first. Nice and even here. Dorsiflexion test, just kind of relax, let this go. Got a little bit of restricted on this side. Good. Okay, we're just gonna bring this down, let this relax, loosey-goosey here. I'm just gonna bring this to tension. We'll give this a little pull like that.
Did you say that my right foot didn't bend back as far?
Correct.
I broke that one in 7th grade.
Ah, I see. Okay. What did you break? Do you remember?
It was the growth plate in my ankle, I think.
We should measure your legs. That might be why you have that curvature in your spine. If you fractured your growth plate there. So go ahead and shake. Squeeze. 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 Okay, relax. Look straight ahead. Okay. Okay, hold your pinky and your thumb together like this. Don't let me pull it apart. Turn it down. Don't let me pull it apart. Up. Okay. Let your shoulders relax. Here, look straight ahead. That's good. Let this come down. Let this drop. Good. Look straight ahead again. Good. Same thing. Hold your pinky and thumb. Hold. Down. Hold. Okay, let's see. Radius. Good. And look straight ahead. Oh, there it goes already. Hold on. It's good. Squeeze. 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 Okay, relax. Okay, let's watch this captivating footage of Carissa's leg measurements while I drop some case notes. Female, 17 years old, presents with low back pain of 3 to 4 years duration with unknown origin. She was given the diagnosis of scoliosis by a physical therapist who examined her and prescribed exercises, which were completed, however, pain persisted. Carissa presented 1 month prior to the visit seen here in this video and informed me of the diagnosis given by the physical therapist just as I was performing Adam's test, which is the patient standing, flexing forward, touching the toes. The thoracic spine is observed. If one side of the spine is higher than the other, it indicates a rotation in the thoracic spine, which implies a possible scoliosis. Positive Adam's test was noted as moderate. We administered 2 chiropractic adjustments, and the results speak for themselves during the interview of this visit and also while the patient was laying on her stomach when we discussed changes in her thoracic spine. And on the 3rd adjustment, drumroll, a vital piece of information was revealed. This information was not submitted on the patient intake form, and it was also failed to be revealed by the patient history taken by yours truly. It was a fracture of the growth plate in her right ankle in the 7th grade, which would have been 5 years ago, predating the back pain. What we potentially have here is a fracture in the growth plate, causing an asymmetry during adolescence, a major period of growth. An adaptation in the body results in most likely a dropped pelvis, but ultimately a curvature in the thoracic spine. Now, the diagnostic criteria for scoliosis is reserved for the A to P radiograph, and a lateral deviation of 10 degrees or more must be measured, which is why I named the title of this video Scoliosis and Going, Gone, referring to the 1, 2, 3 chiropractic adjustments that she was given. And, spoiler alert, let's perform Adam's test one more time and see just how effective the chiropractic adjustment was in this case. I am honored to share this medicine with everyone. Thank you very much for watching. Stay tuned for some experimental content coming right up after this. Thank you. Grazie, gracias, merci, donka, arigato, si. Okay, so let's do this. Go ahead and bend forward and touch your toes. Okay, the rib humping here is almost perfect. So there isn't even any yet. It's perfect. You ready to go?
Thank you.
Okay, you're welcome. All right, go ahead and walk around. Take that for a test drive. Let's take a look at the precision timing of a chiropractic adjustment. Here's Carissa's upper cervical adjustment seen in this video. There are 2 muscles observable in this view. The first is the SCM and the second is the scalene. When these muscles are activated or contracted, a noticeable shadow can be seen. Fast forwarding through the adjustment, let's rewind it back. Here's after the adjustment, you can see these muscles are fully contracted, creating the observable shadow. Now, this is at the maximum point of the thrust. You can see there's very minimal shadowing of the SCM muscle especially. Now, let's move through the adjustment one more time and rewind it back to several moments before the adjustment. You can see there's a moment where we observe complete flattening here, where there's complete flattening. This would have been the optimal time to make the adjustment. However, I pulled back and then moments later, I went through the adjustment. Now, during the initiation of the adjustment, there was mild contraction of the SCM muscle, but as I moved through the thrust, you could actually see the SCM flattening out until I reached the end range of motion, the paraphysiological space, which will stimulate the body's natural response to contract reflexively and restore joint balance. It's a natural mechanism. It's supposed to happen at the end range of motion. Here's a preview for Aubrey, an upcoming visit. This is a lower cervical adjustment, as you can observe, with the stance that's taken at the inferior aspect of the table, which allows me to achieve the inferior to superior thrust. Once the elbow drops down to parallel to the spine, it will help achieve
the posterior to anterior aspect of the thrust, and of course the lateral to medial. Even though the P to A, L to M, I to S line of drive is mentioned in 3 separate linear forms or 3 straight lines, it is important to note that this adjustment occurs through an arcing motion, a curvilinear line of drive, because there are not many straight lines in nature itself, nor are there in the human body, and especially not in the articular surfaces of the human spine. Now, let's take a look at that adjustment. Watch for the elbow drop, indicating when I will begin the thrust, happening just shortly here. You can see the contraction of the SCM as I start to engage, and then here the elbow drops and I begin the thrust. This is the end range of, let's bring it to the end range of motion of this thrust, where you can see the reflexive activation of the SCM muscle. And then when we rewind it back just 2 frames, 2 milliseconds, you can see the mid and full way through the thrust. There's flattening of the SCM until I get the end range of motion, the paraphysiological joint space where the SCM is reactivated to help return to normal stabilization of the cervical spine. And so the point is, not only does the patient have to be relaxed, but the adjustment has to be faster than the patient's ability to resist. Okay, now breathe. And out. Good, loose.
That was good.